Hi everyone, welcome to How to Learn Medicine channel. This is Medician. Today, as the first video of this channel, we're going to talk about precision medicine. I'm sure no matter you're a medical student, resident, fellow, or former physician, you have heard of this term and someone has promoted to you or urged you to learn it. Embrace and learn precision medicine. And this is exactly why we're having a talk today, because I really want you to think twice before you jump onto it. Before start, I want to let you know that the concept we're talking today is so important and no one is going to tell you the truth. I want you to stay focused and we'll finish it in less than 10 minutes. First question, you should learn precision medicine. Is this the truth or a myth? And actually, it's a myth. Now, don't get me wrong, the idea of precision medicine is good, which by definition, precision medicine means to deliver the right treatment to the right person at the right time. However, just think about this. Has this concept ever been changed in the medicine field? No, it never changed. As you always remember that you are told by your attendings or professors to get the correct diagnosis and treat your patients correctly. So why is this term has been brought up again nowadays? Well, before we talk about the reasons, here is the conclusion of precision medicine. It is almost impossible for you to practice precision medicine. Why? Because there's just too much information. Let's use one of the most common disease, asthma, as an example. Here are a list of knowledge points that you need to know if you ever want to ace precision medicine in asthma. You can pause the video for a second and take a look, but I'm gonna read it through very fast. Starting from clinical history. What are the most important clinical symptom signs to predict future asthma exacerbation? What are the screening questions to rule out other differential diagnoses, such as vocal cord dysfunction or tracheomalacia? Regarding laboratory testing, which biomarkers do you check? FeNO, Perostin, serum or sputum eosinophils, or total IgE. As for diagnosis, what is your patient diagnosis? Type 2 high asthma, type 2 low asthma, or other asthma? And finally, thinking about treatment. What is the difference between those different inhalers? Which is the best inhalers for your patient? Have you known most of the asthma medications starting from a daily pill montelukast to once every 2 months benralizumab injection? Have you known each medication's strength and weakness from their pivotal trials and how to apply precision medicine to each individual patient? This is just a very brief list, nothing but a tip of iceberg, and it is only asthma by itself. Let me show you another example. This is what you need to know if you want to use proton pump inhibitors for acid reflux. See how much you need to know. And this is only one medication for one single disease. Now you understand the problem. Assuming you are not seeing only one disease, there's no way for a doctor to memorize such huge information at all. This is precision medicine created to explore your brain. In the real world, things get more complicated because your patients, most of the time, are not textbook cases. Even you're a specialist, it is still sometimes hard to treat on the target. So let's back to the earlier question. If it is impossible to practice precision medicine, why this term has become so popular now? This is a $1 million question. If you're thinking this is the nature of scientific advance or progress of medicine, sorry, you only have right. Because the other reason behind the scene is a result of competition, an endless cycle of scientific competition. Initiating from competing researchers and scientists, this huge amount of study and research data has led to a publication explosion consisting of both useful and not quite useful info. Subsequently, it has generated excessive disease reclassification with new phenotypes and endotypes, which has brought up the contest of pharmaceutical companies with their novel but sometimes similar drugs. With the nature of new knowledge or invention is to make our life easier, what are we studying in medicine right now? Epigenetics, microbiome, proteome, metabolome. How much more information you can take? Therefore, what do you think would be the easiest way to deal with this problem of information explosion? That's right. Further subspecialization, right? Now each doctor is only dealing with one single or few diseases, which is a lesser knowledge burden. But is this the mission of promoting precision medicine so that gets you further subspecialization and treat your patient more precisely? Or is this just a quick exit to avoid physician competition? And there is your competition once again. The other thing, what may be the problem if you further subspecialize? Let's say if you're an asthma specialist, which means that you're going to see more difficult to manage cases. With the reminder that most asthma patients can be controlled on usual medications without seeing an asthma specialist. You may end up seeing one difficult asthma case for 1 hour, while the other doctors finish a total of 3 easy cases by using the same time. Then, as the final questions of this talk, here comes the biggest question. Do you think that your hard work of studying precision medicine will be recognized or be compensated if you see just one patient compared to other doctors who have done with 3 patients already? Thank you for watching. Please let me know what you think, or if you have any additional comments or suggestions. I don't know how to make good animations or colorful video editings in this video, but we're going to tell you the truth and help you to learn medicine. Stay tuned as we will upload more videos in the future. Subscribe to the channel if you like it. Thank you.